Health webinar of the year on the topic Breaking the Silence, Empowering Yourself. This insightful session is being brought to you by Ecocivilisation in association with Vaha Women and Chiraziva. I am Dr. Rajni Vohra, founder of Vaha Women, and I am honored to be joined by a distinguished leader, Dr. Violeta, founder and curator of Ecocivilisation and former Deputy Prime Minister of Slovenia and EU Transport Commissioner, alongside with my friend, Eleftheria Kakambouras, founder of Chiraziva. Friends, as we all know that mental well-being is the foundation of any thriving society that impacts productivity, relationship, and overall quality of life. And we believe that it's a collective responsibility, not an individual one. And this sense of responsibility has led us to initiate dialogues like this and open conversation. To delve deeper into this crucial subject, we have invited three brilliant speakers with us today who will share their insights in a short while from now. And now it's my honor and privilege to invite Dr. Violeta to share a few words with us.
Hello, I'd just like to greet you all in the name of Ecocivilisation movement and of course all of us who are supporting this year of mental health, which is bringing us closer to one of the biggest challenges of the 21st century, is the darkness within us. Because if we do not address that and if we do not bring light into our inner world, how can we address the challenging questions that are surrounding us on a local, regional, and global scale? So it's really the global framework that is losing the stability, and it's reflecting so much the way how many people react to this uncertain world, which is seem to be chaotic, seem to be very unpredictable, and seem to be in a way in a dissonance with all the natural laws and everything that humanity represents in this natural order. So it's great to be part of this series, to listen and to learn and to educate ourselves. And of course, it's the sole purpose of this series this year is to raise awareness regarding mental health, is to challenge stigmas, is to create safe spaces within people can freely speak and share their experiences and wisdoms, and of course to provide some guidance for resources that can be used while addressing that. And what we are trying to bring forward within Ecocivilisation movement is really the awareness of the importance of relationships as possible next important value creator of the next civilizational paradigm. And to be able to enter these relationships with confidence, we got to get very familiar with as many layers that are cross-pollinating within ourselves as possible, being the physical layer in a relationship with our mental level, with our emotional level, with our spiritual level, with our social level, and with our intuitive selves that is connecting us to the collective and is trying to find some balance with everything that it is in the moment of now. So greetings from myself and from all those who support this year of mental health. And I can't wait to listen to our today's guests. So I'm passing the word back to you, Rajni.
Thank you so much, Violeta, for your golden words. And now it's my pleasure to invite my dear friend and co-host, Eleftheria, to set the stage for today's discussion. Eleftheria.
Thank you so much, Rajni and Violeta, and welcome to our panel of speakers and all of our guests and everybody that's going to be watching this on the replay. I wanted to just invite us into a moment of just a little bit of self-care, and I would love to invite everybody to just open up to this beautiful excerpt from a song that I found, and I would love to read it to us. So my invitation is to just get comfortable on your chair, Maybe just feel your feet on the ground. If it feels comfortable to you, you can close your eyes and just bring your awareness to the breath. And for a moment, just do a self-care check-in. Just allowing the breath to just take you to a deeper and quieter place. I just offer you these words from the song Radiance by Jai Uttal and Ben Leibach. Peace to the inner and outer environments. Peace to the 5 elements within and without. Peace to this body. Peace to this mind. Peace to this huge ocean of emotions and feelings. By the power of the truth and for the happiness of all beings, may we have a culture of peace, a society of peace, a world of peace, where we can have days of peace, nights of peace, sleep with peace, and dreams of peace. And by the power of the truth and for the healing of all beings, may we have peace in all moments and in everything. I just invite you to take a deep belly breath in. Just exhale out with a big sigh, just allowing your body to relax completely. When you're ready, just gently opening your eyes. Welcome, everybody. And I will hand back to Rajni now.
Thank you. Thank you so much for this brief meditation. And honestly, this absolutely helped us center our minds to focus on this session today. And we are ready to dive into this enriching conversation with our esteemed panelists, with our guest speakers. And let's begin by welcoming our first speaker, Dr. Ruksheda, Mumbai. Dr. Ruksheda Syeda is a distinguished psychiatrist with over 24 years of experience. She runs a private practice in Lokhandwala, where she specializes working with teenagers, young adults, women, and families. So let's give a warm welcome to Dr. Ruksheda. Dr. Ruksheda, over to you.
Thank you, Dr. Rajni. At the outset, let me please share my appreciation for About Women and for Ecocivilisation for bringing all of us together and talking about such an important topic. I'm a psychiatrist by profession, so of course, I think it's very important. Having said that, it's not just because I'm a psychiatrist, but I'm also a human being. I'm a woman. I work with people. I live with people, so I understand on a day-to-day basis how important our mental health is, not just for health in general, but society at large. And I think that really, it resonated with me when the panelists spoke about what we want to do, what we should do, and how we actually began the session as well. So at this point, is it okay for me to share my slides? Is that fine? I'm not sure if I'm being able to share my slides here. For some
Can
reason,
you
there's a
try? Can you try once again?
yeah. For some reason, it's not showing the slides.
Well, the multiple share is open.
Right, but for some reason, some technical issues, I am not sure why it's not showing at my end. Is it okay if I go without the slides? Is that fine?
Okay,
Yeah, all
please go
right.
ahead.
While it would have been nice, just because the visual and the auditory makes for a better learning, but I'm definitely not reliant on it. My only disclaimer is that I do love my work and I do love the subject of mental health. So I can go on and on about it, and I'm going to really try very hard to stick to the time that I've been given. So with this, just to dive into what all of us think mental health is, right? Mental health is emotional, psychological, and social well-being. Mental health is how we think and feel and behave, definitely. But mental health is also how we learn and make decisions. Mental health is how we perceive and handle stress. Mental health is how we bond and nurture relationships, and all of that and much more. Mental is also on a continuum. It's a range from wellness to illness. At any point, I may be at any given spectrum, at any point on the spectrum. Of course, we hope more and more people are towards the wellness and not towards the illness. And that's one of the reasons that we are here together today. Mental health can change depending on circumstances as well as events, right? If I'm going through something, if I'm facing something right now, I may, if I've had a bad day, I had a fight in the house, or, my kids didn't listen to me. So I could have a low day. I could have a bad day. If I'm dealing with a grief, a loved one died, whether that's a family member who's a human, or, a dog or something like that. Of course, I'm going to go through some amount of issues as well. Having said that, they're not responsible for illnesses particularly. Mental health and psychiatric illnesses are also subject to change in my internal as well as external environment. So let's say I'm someone with a metabolic disorder like diabetes or maybe a thyroid dysfunction. My chances of having a psychiatric illness like depression or anxiety increases, right? Let's say I'm a regular person, a woman going about my daily activities. Having said that, I have a severe case of PMDD, which is premenstrual dysphoric disorder. So if I'm expecting my periods, the week or 10 days or even 2 weeks before that could be more challenging as far as mental health is concerned, and I could have various issues with my mood and my behavior. So it definitely can alter with that. Let's say I come from India, so we do have a lot of tuberculosis and we have medications for tuberculosis. A lot of the times, medications for tuberculosis and even malaria for sometimes can have an effect on my internal environment and trigger mental health issues and psychiatric conditions. So it's dependent on my external and internal environment. The external environment, let's say if I have an acute trauma or a chronic stress, that can also trigger my underlying issues, and it could give rise to a mental health issue or a psychiatric illness. Another aspect of mental health is that we really do want to emphasize on mental health literacy more. We want to, because that's going to promote overall health, which is very important for us if we are going to look at our lives in totality and not just in a compartmentalized way. um, how is one supposed to kind of like figure out, right? Because I just said things like, oh, stress and things like mental health issues and a psychiatric illness. I talked about a range, it being a continuum and on a spectrum. So very simple, small little things that we could do, right? If I am looking at like a stress or a mental illness, let's, move away from wellness and just look at stress versus an illness. The first first thing to look at is duration, right? Stress can be temporary. It can have, it could be because in response to a specific event or situation. Mental health disorder, on the other hand, will be persistent and long lasting, and there's no clear link to a specific event. When we are looking at impact on day-to-day functioning, on how I am being able to go about my daily activities or chores or responsibilities, whether that's at work, at home, interpersonal relationships. Now, if I'm just going through a stressful period, during that time, I can manage my daily responsibilities. I may feel overwhelmed. I may not be able to function as well as I would ordinarily, but I'm managing. With a mental health illness, on the other hand, it can have a significant impairment in my day-to-day functioning. Even if I'm a student, I might not be able to focus on my studies. I might not be able to remember or understand or do problem solving. If I'm a stay-at-home wife and a mother, my ability to take care of my child or my household could also be challenged. The other aspect of what we could look at is also response to coping strategies. All of us we do have some strategies, we do have some coping mechanisms. Now, if I'm just under a stressful condition, stressful situation, I'm having just mental health issues, stress, it will respond to maybe relaxation activities and techniques, breathing activities, yoga, things like that. It can also help if I have more social support. I can, if I focus more on self-care, so that's going to respond very well to it. If I have a mental health illness, on the other hand, I will require professional help. The treatment will and can include both medications and other therapies, of course, along with lifestyle management and other aspects as well. So that's how we can differentiate if I'm having a mental health issue, a stressful situation, responding to such stressful situation, or if I'm having a mental health illness. What do I see? Like if I do feel that I may have a mental health illness, what do I look at? So when we think of it as physical, psychological, psychiatric, and functional, then it is a little easier for us to understand. In physical, I could have sleep disturbances. I could have appetite changes, weight changes. I could have different aches and pains, multiple physical issues on a day-to-day basis. On a psychiatric level, I could have mood swings, negative thoughts. I could worry. I could self-harm. I could have suicidal ideas. I could maybe hear voices and have perceptual abnormalities. And on a functional level, on a day-to-day level basis, I may isolate myself. I can't focus on my daily activities. But again, the difference is also about the duration. The difference is about the intensity of the situation. So that's something that we can kind of focus on and remember that if these, if physically I'm not feeling well, psychologically I'm not feeling well, and on day-to-day functioning I'm not feeling well, that may mean that I may have a psychiatric issue, a mental health illness, and I want to discuss and go see a professional. Now, who are these professionals? Professionals can be psychiatrists, definitely. Professionals can be psychologists and therapists. Professionals can be social workers who are more trained in psychiatric aspects. And of course, there are other supports professionals. I come from India. There is no uniformity of healthcare. So in such cases, we also encourage people, if you have any doubt, if you're concerned about yourself, go see your family physician or your general physician. They're easier to reach probably, even with limited resources, you can get some amount of professional help. If they feel that yes, there is some kind of psychiatric issue and they're not being able to handle it or diagnose it for that matter, they will escalate it to a specialist. And, that's how you want to go. Now, usually what happens is when you see a psychiatrist, and so the plan is to see, first to get a diagnosis. Do you have a psychiatric illness, or are you going through an adjustment phase of something or the other? So psychiatrist is going to definitely look at various parameters and either come to a diagnosis. the best outcome are always, if you do have a psychiatric illness, the best outcomes are going to be a combination of medication, psychotherapy, and a lifestyle management plan. And that's something that you can discuss with your psychiatrist and other care providers. If you're finding it challenging, for this medication doesn't suit me, or I don't know how to manage my everyday life, or where am I going to get the psychotherapy from? All of those things are something that you can discuss with your healthcare provider. So mental health literacy at the end of the day essentially means is understanding mental health. It's the ability to recognize problematic symptoms, ability to figure out whether you're going through a mental health issue, or if you're going through a psychiatric problem. And the third aspect is to also learn and know where to reach out for help. Who's your friendly neighborhood psychiatrist? In India, we don't have an insurance-based healthcare. We have a public healthcare system and a private healthcare system. So it is rather easier for us to reach help more, faster than most of the developed countries out there. So it does help a lot of us for that. Of course, mental health literacy also means having the knowledge, but also the correct attitude for yourself and for the people around you that you love and care for. The attitude for promoting recognition and of psychiatric issues and mental health problems, as well as seeking, appropriate attitude towards help-seeking behavior. I always tell people, ask for help. Right? We have to say no to stigma. We have to stop shaming treatment. And we have to remember that only the strong and the wise know when to ask for what kind of help and from whom. So let's all be a little wiser in that sense. Like I said, in India, there are a lot of resources available, both in private as well as public. But for those people who might not know where to even begin with, we have we have a helpline called Telemanas that has a Government of India initiative that's available everywhere all across our country. We have similar helplines available in different countries for even different disorders for that matter, which are state-run, federal-run, even private-run as well. So reach out, ask for help. If you don't know what to do, just ask someone, ask a professional, and they will be able to help you out. And just, always remember that, when you're trying to help others, right? First, check in with yourself. Am I okay? Do I have the time and capacity to help people around me? And only then offer help, right? And if you're offering help, maybe it kind of helps to ask, what is it that they might need help with? How do they want to be helped with, rather? We're talking about just in a crisis, not like in general as such. Sometimes all they want is to be heard, and just, sometimes all they want to be is hugged and just sit there and, be with me, hold my hand. Sometimes they want to discuss issues and come up with some kind of solutions. So there are different ways of helping each other out. And I hope that, I hope that a lot of us are more prepared to take care of ourselves, more prepared to take care of people around us, work on self-compassion, definitely, work on empathy, because that makes it easier. It makes life smoother. It makes all of us happier. And at the end of the day, if my needs are met physically as well as psychologically, I do better. I do well. That's good for me. That's good for my family, my community, and my country at large. And globally, of course, that's going to help if more of us are in a happier place than not. So with this, I'm going to just say that I wish all of you all a very, very good mental health, and more power to you for taking care of yourself and people around you. And with this, I'm going to hand it over to Dr. Rajni to take it forward.
Thank you. Thank you so much, Dr. Ruksheda, for your incredible insights. I always believe that if you truly want to know, truly want to understand the real face, the real picture of any society, either meet any medical professional or a legal expert. Because these are the two professions where people witness changes in society faster than any other profession. They always have first-hand information. And considering that aspect, I would love to know to let us know the current scenario of the society, how much social media is impacting kids psychologically as well as teenagers.
Social media is omnipresent now, right? A very small percentage of the globe would be not on social media of some kind or the other. Even if people who are not on social media will have some kind of digital presence in somehow or the other. And, so we know that it's always there. So clearly, when something's surrounding us so much, it is going to have an impact on us. It is not sparing adults. So we definitely know it's not sparing our children as well. Technology in itself is not an issue. Telecommunication technologies are definitely not an issue. Social media by itself is more is more layered, is more dangerous in that sense, because there's less supervision, there's less, and there is more. There are more chances of that impacting us negatively and creating more issues than helping them. So to say that, okay, all social media is bad and all of that is definitely not true. But we do see that there is a definite strong association between extensive use of social media and different aspects of mental health issues like, focus issues, attention span issues, interpersonal issues, social interaction issues. And definitely on a personal level, we see this more in women than in men, and young girls especially. A lot of self-doubt, a lot of body image issues, a lot of insecurities. Unfortunately, these, communication technologies are also driving the loneliness in that higher. Previously we would see that older adults would tend to be more isolated physically, and that's why there would be more loneliness. But we are seeing more and more young people now being lonely, even though they can now reach out to more people socially, but that's in fact making it worse. So social media is impacting in a lot of different ways. Again, like I said, it's how we are using it and how we are not really teaching our young people to use it. That's the point. I'm not saying it's the evil and it should be driven away from our homes, but I'm definitely going to be very, very aware of what age my child is going to be using social media, what content are they consuming, what content are they creating, how is it shaping their personalities, how is it shaping their everyday behavior. I am going to try and take care of it. But I'm not going to be able to do it if I can't get away from my smart device. So I do encourage older people, adults around children to model how not to always be stuck on their devices and how not to only look for social media. But one aspect also helps is with so much of AI that comes in, and young people are a little bit more aware because, again, of social media as well, of climate change and all of that. And if you tell them that for every time that you click a button or you write something at ChatGPT, how much power it's consuming and how much it's costing the environment, that also helps them kind of monitor how much they're using, right? Like a simple thing, like even if you're using whatever AI, when you're using please and thank you, it takes more energy and it takes more resources. So just to train our children as well of judicious use of social media and other AI generative AI tools is going to be something that is a very, very essential part of us raising them.
Okay, so doctor, just let me know one thing. How does a parent can ascertain or find out that the child needs de-addiction now and they need to possibly see a therapist?
From smart devices and social media, the addiction from social media.
Yes, yes.
Right. So thank you so much for that question. I think that's very insightful. Like, what are the red flags? What do we look for? So if you notice that your child, and I'm saying child and not just a teenagers, because unfortunately we do see even little children, toddlers with a smart device in their hands. Not particularly social media, but we're going to talk about smart devices, not just internet and AI and all of that, but smart devices. When we see that, okay, our kids are not going to be able to have a normal conversation with us without having something on their hand, understand if they're not, if it's impacting their day-to-day functioning. Like I said, they're not being able to sleep on time, they're missing school or college, their academics are something that's not either interesting to them, or there's scholastic performance issues. These are the other aspects. But from a personal point of view, if you see mood changes, if you see irritability that's increasing, if you see isolation that's increasing, if you see less interaction just with family, and maybe not, because you wouldn't be able to know whether they're interacting as much outside. If you're seeing all of these things and they're consistently present, or they're consistently increasing, that's definitely something for us to be a little alarmed about and reach out for professional guidance. I always tell people that if you say something, that might be labeling, but if I say as a professional, that could be a diagnosis. So I would tell parents not to just say, oh, my child is addicted and things like that, but definitely say that, okay, maybe there's problematic use, and use the right words instead of labeling your child, because that's again not going to make it easy for you to help your child. The child is not going to be cooperative for help seeking. So when you see these red flags, and like I said, more consistently, or an increasing in a step ladder approach, definitely take them for professional guidance and take help.
Thank you. Thank you so much, Dr. Ruksheda. And we request you to stay with us. Okay, Violeta has one question for you.
Just a quick one. I'm very much now trying to learn and observe these different natures that are evolving around us. The natural earth, authentic nature, the nature we created, which we call communities, and now this third nature, which we call the virtual world. But each of these natures has a completely different rules of behavior, do the sort of a different setups within which people evolve, right? And especially the nature 2, nature 3, we have solely created those rules. Nature 1 is up to the creator of Earth. So how do you see, I mean, well, what would you point out as the biggest difference in a way how you approach to address this challenge that you so vividly described just now, in between community-based mental health challenges and then virtual, this nature 3 based community challenges? What would be the biggest shifts or changes or upgrades or innovations to address the virtual world challenges?
So again, a very, very good question, but I think it's a little loaded. So I'm not sure whether I'll be able to do justice with the answer I'm going to attempt. So be patient and kind with me. For that to change, for us to see to it that the digital world that we are living in, or we are, also providing for our children, that's conducive to their growth, that's conducive to their health, that's conducive to their peace and happiness. We have to change on an individual level. We have to change. We have to make ourselves so powerful enough that we can also, talk to policymakers and see to it that those policies are in place for, because we definitely don't want to reject digital spaces, but we definitely want to make those spaces more safe. And that's not going to happen unless and until we're not going to, like I said, see to it that those changes are brought about and implemented. In India, we do have great laws and great constitution, but our challenges are about implementation. So it comes from that kind of experience as well. But I think on an individual level, if we are more if you're working more on our own integrity, if you're working on our conscientiousness, and if you're being more mindful of ourselves and of the people around us, that's also going to really, have a bottom-up approach towards also so-called cleansing the digital space, right? It's about teaching our children how to even spot what kind of content may be harmful and what kind of content is going to be okay for them. It's about teaching them how to balance their lives between the digital and the virtual. It's about us teaching them the difference between fiction and real, which is kind of getting blurred. And with more and more technology that's happening. But again, this needs to be taught, and this needs to be taught to parents. This definitely needs to be taught in schools. This needs to be taught to people in power, whether they are community leaders, whether they are government officials, whether they are policymakers. With or without all of this kind of collective effort on an individual level, community level, and policy level, we're not really going to see a lot of changes, and we're going to forever just be struggling with newer and newer challenges that we may come across. Even in the last 20 years, and the digital space has changed so much that 20 years ago, the challenges because of digital media or digital spaces was vastly different than today. Having said that, exploitation of children remains. Whether we talk about, a physical, mental exploitation, or even sexual exploitation, that is unfortunately pervasive. And that's why, again, if we are more, if we're working on ourselves individually, and we're working on empowering our children, and we're also helping them learn how to empower other children, I think that's also going to be a very, very doable, like I said, bottom down to top approach. And everybody has to work together, which is, I know, a utopian, utopian dream, but that's something that I think we do need to work towards. I hope that answers a little bit of your question. I'm not sure whether I've done justice to it.
Thank you. Thank you so much, Dr. Ruksheda. And we request you to stay with us because we are coming up with two more incredible presentations. So request you to stay with us. And now it's time to invite our next panelist speaker, Dawn Evans from the UK. She's a serial entrepreneur, founder of Wales' largest mental health event. Dawn specializing in motivating and inspiring, developing startup and growing health and wellness businesses. Her passion is in physical and mental health. She's a qualified mental health and first aid tutor. And through her mental health webinars, she has educated thousands of people. Her company, Ajuda, has trained 150,000 people in accredited first aid and mental health qualification, giving them the knowledge to save lives. We are very honored to have you, Dawn. The floor is all yours. Unmute yourself.
It does help if I unmute, doesn't it? Thank you so much, and brilliant presentation as well from Dr. Rasha as well. So some of it's repeated, but it's nice to reinforce some of the facts as well, which I'm going to allude to today. But just talking on mental health, I mean, it's good that we're all talking about it because the stats are, frightening. Nearly 70 million working days are lost every year due to poor mental health. I mean, years ago, muscular was the #1 reason why people weren't in work. Now it's poor mental health, with 1 in 4 of us experiencing a mental health illness. And that's costing the UK economy as a whole £70 billion. Which is equivalent to about $100 billion each year in loss of productivity and absence. So it's great that we're talking, and we alluded to education. We need to educate people because people are not talking about their mental health because they're scared of stigma and shame that will bring upon them. So we need to encourage people to talk about mental health. So I'm really pleased to be on this panel today where there's no stigma, there's no shame, and we can talk openly about mental health. And there's lots of reasons why people don't talk about mental health, because they're fearful of the stigma, of judgment, of people labeling them, giving them a label. If we went into the workplace and we said to people, we've been diagnosed with cancer, we would get the response, are you okay? What can I do for you? Can we give you hope for the future? What do you need? But because they've got a hidden illness, which is mental health, then there's name calling and shaming. So by holding spaces like we are today, we can help destigmatize mental health and more conversations. So, but also have a look at the way we work. You know, there's lots of things that's contributing to poor mental health, you know, overworking, trauma, bullying, having a baby, bereavement, many worries. We're in a cost of living crisis at the moment, where sometimes if you went for a local authority job or public sector, you'd have a job for life. There's job insecurities now. There's no stability. And then obviously we've got abuse and stress and anxiety. And we need to help people with poor mental health. And we can't help them unless we know what the signs and symptoms are. And we've already alluded to some of the physical signs like weight changes and headaches and stomach upsets and indigestion and panic attacks and heart disease. I had a friend who had really poor mental health and he started losing his hair. It was stress-related alopecia. He went to the doctor and the doctor said, "You're lucky it's your hair, because if it wasn't your hair, it could have been your heart." So we've got to really, really look after ourselves and dig deep, because it will come out in physical symptoms and we don't want that. Emotional symptoms, look out for people who are crying, who are anxious, who are irritable, who are feeling demotivated, poor grades. If you're talking children, we alluded to children just now, you know, their grades are going to go down. They're going to socially isolate themselves, and they're going to be very introvert. So we're looking at anxiousness, we're looking at emotions being exaggerated, we're looking at loss of interest in friends, we're looking at people not leaving the bedroom, not wanting to get out of bed for 2, 3, 4 weeks. You know, we can all have a down day, we can all have a sad day, but when you're physically depressed, then you're going to be sad for 2 weeks or longer. So we're looking out for these signs when people are remaining depressed, when they can't have the energy to open their curtains, to put their shoes on, to get dressed, to have a shave, to wash their hair. Are they wearing the same clothes for 2, 3 days? So these are signs that we need to look out for. And again, how they behave around friends, around people, around food. Social gatherings, are we starting to avoid social gatherings? Are we reliant on addictions like smoking and drugs and alcohol? So these are behavioral signs. Are we starting to miss deadlines in work? Are we overworking? Are we overconfident? Are we underconfident? Are we got irrational behaviors? Is our productivity decreased? Is our punctuality decreased? Are we finding it hard to engage in conversations? You know, if all these go unnoticed, then we can get burnout. And I've experienced burnout twice in my lifetime. And you don't realize burnout is happening. Sorry. You don't realize burnout is happening to you until it's too late. You know, 9 out of 10 adults in the UK experienced high levels of stress last year, with 1 in 5 of us needing to take time off in work. And 49% of workers state that their employees haven't got the skills to spot the signs when they're burning out. So if they can't spot the signs, how can they help you? So we need to look and see and recognize in ourselves so we can help ourselves. So what can we do to prevent the burnout? Well, first of all, I think we need a well-being plan to look after yourself. That includes your food, your exercise, your sleep, your diet, regular check-ins with yourself, with others. Communication is essential to mental health. You don't realize the conversation you're having with someone might just be a life-saving conversation. So regular check-ins all the time. And acknowledgements as well. When someone's working hard, tell them they're working hard. When someone's being productive, tell them they're being productive. You know, we're quick enough to criticize people, when they miss deadlines, but we're not as quick to compliment people. And I think those compliments are important for well-being. And it's just having those conversations. We're actively looking for signs and symptoms, but think about the environment that we're in. Think about the environment that we're creating as well. And this goes from children, the environment that they grow up in will determine their mental health. If they've got a thriving environment, then they're going to have a thriving life. It's like if you put a bad piece of fruit into a bowl, then the whole bowl gets contaminated. So think of the environment. If you've got a good living environment, then hopefully you will have good mental health as well. But mental health don't choose who it discriminates against. Mental health doesn't choose age, it doesn't choose gender, race, social status, lifestyle, job. Mental health can happen to all of us. We can have good mental health, we can have poor mental health. And we've touched on medication for it as well. But I just want to stress on conversations and well-being conversations, because we don't have enough of them. And conversations, are saving lives. I've been following a man called Kevin Hines. I don't know if you know of him. He's an American guy and infamous for jumping off the Golden Gate Bridge. And he survived, and whether God was looking after him or not, but a seal came up and lifted him to the surface that day. And he said, the minute my hand left that bridge, I knew I did not want to die. But all I wanted was for someone to ask me if I was okay. Nobody approached me. Nobody asked that question. So I jumped. And if we can just ask these questions, if we can take time out to check in with people, it's so good to talk. That conversation could be the most important conversation you have that day. It's going to reduce hidden burdens. It's going to reduce shame. It's going to build connections. It's going to help people feel supported. And we just need to give ourselves the confidence to talk to others. So ways of keeping a conversation going. Listening is such a hard skill, and it's an underrated skill. Listen with the intent to reply, which is what most of us do, but just listen without interrupting. Listen and be non-judgmental when you're listening, because you might not always like what comes back to you. It's good also to summarize and repeat what people say to you as well, because by repeating what's been said, it shows you've been actively listening to the conversation. Using verbal prompts and also pauses. Pauses are powerful when we're having well-being conversations. But what we've got to be scared of is giving too much advice and the word I'm fine, because we all know I'm fine means I'm not okay. So I'm just going to round up by ending with my 4E approach. And the 4E approach is environment, effective communication, empathy, and engagement. So when we're having these well-being conversations and when we're talking to people, it's really important to consider the environment. We've talked about social media already today, but we need to make sure when we're having well-being conversations that we create a safe place, no disturbances, no phone calls, no emails, no, I've got to be at a meeting in 5 minutes time, you need to be quick, because we're getting all held up in this rat race of work. And we just need to take time out and be present, because we can be with people without being present. Effective communication, our body language. It's no point sitting there looking at your watch, folding your arms, looking out the window. Again, eye contact, be present when we're with people. Empathy, showing empathy, understanding the person and trying to understand what they're experiencing with their poor mental health and knowing where to signpost them. And the last one, engagement, offer our ear, but offer empathy and be approachable and be practical, assist them to maybe help and resources, assist them to local charities or local helplines. So that is all about mental health. You know, we're all fearful of the word mental health, and I just think if we can educate people more, we can destigmatize the whole conversation. And this is why I was really keen to join in this conversation today in this panel, because it's really great that we're all talking about mental health. We're talking about stigma, destigmatizing, and you know, people are judging. And we want to reduce the shame. We want to build connections. I'm here in the UK. We've got people in India, and we're having a global conversation. This is a global movement that I'm really proud to be part of. So thank you for inviting me. And I just want to end on one of my favorite quotes, which is by Desmond Tutu. And Desmond Tutu says, "There comes a point when we need to just stop pulling people out of a river. We need to go upstream and find out why they're falling in." So thank you.
Thank you. Thank you so much, Dawn, for addressing some of the most critical yet often overlooked points, I would say. And I have seen many myths like everybody in this world. And one myth that is very common is that the belief that mental health issue only happens to certain kind of people, you know, especially those who have some kind of history, family history. Do you think genetic history matters when it comes to mental health issues?
Genetic history, thank you for that question. Genetic history does play a part of mental health. Like I said about earlier about putting a bad piece of fruit into a bowl. You know, if you're brought up with conditions such as ADHD, depression, anxiety, bipolar, schizophrenia, they all have I can't say the word now. Help me out with the word.
Heritability.
Yes, sorry, I'm dyslexic. Sometimes it pops in every now and then. So that will increase the risk of mental health. So so genes are part of the continuation of family mental health, but we've got to think of other contributing factors as well. Things like the environment, things like past traumas, stress, upbringing, your social circles. Are you using substances? Because substance use has also got a link to giving a poor mental health. So the answer is yes, I believe genetic history is part of it, but it's only a small puzzle piece. It makes up part of poor mental health. But with any mental health, early intervention is a must. The earlier we can get help, the better.
Yeah, may I add?
Yes.
So when we think about genetics, we only think about the inherited genetics. And like how Dawn pointed out, there are a lot of other aspects that impact our genetics throughout our lifespan, including climate change and all of that. So those are epigenetics. So all illnesses, whether they are physical, psychiatric, whichever way you're looking at it, all medical illnesses are an expression of our genetic genetic basis. Having said that, what might how those genetics evolve makes a difference as well. So it's not just my family genetics that's important, it's my personal genetics that's important. Sorry, I just kind of wanted to add that. Thank you.
Really good point. I think we froze. I think we've lost our host.
Yeah, I think
That was a
right.
really good point. So thank you for adding that in as well. I think it's just me and you left. The others are froze.
Yeah, maybe.
I'm still here, but I'm not a host, so I can help you with that.
Right.
Right.
I think she's yeah, hopefully she can join back.
Great. Can you still hear me and see me?
Yes, yes.
Yeah,
we can.
okay, great. Thank you so much for that, Dawn. And I'm also quite curious about, you just mentioned dyslexia as well. And I think it's another conversation that really needs to be opened up, is neurodiversity. And I'm really grateful that there's more talk about it now, because I think we also need some education on that, specifically with parents and children, and when it comes to, you know, children's names for one another as well, and maybe the school system that could support it in a different way. And I was wondering if you wanted to share anything about neurodiversity and education. Is there education that you do around that in terms of mental health, especially if it's not being spoken about?
Yeah, I think I'm not an expert in neurodiversity. I have two children who have ADHD diagnosis, so obviously I've got lived experience, and myself with the dyslexia. I know it's harder to detect in girls than boys. My son was diagnosed at the age of 5, and my daughter got diagnosed at the age of 24. So, and a lot of women that I talk to who are neurodiverse have often gone unnoticed during childhood and adolescence. So it's harder for females than males when you're talking neurodiversity. And very, very different symptoms as well. If I look at both my children, they're both neurodiverse, but very, very different symptoms. But I do know that, you know, 50% of all mental health concerns are started, you know, by the age of 14. So we really need to look at adolescence, because like in my daughter's case, she got diagnosed at 24. It's gone unnoticed by teachers and through the education system. So I think it's great that we're talking about it, but it needs to be talked about in schools. It needs to be identified at grassroots, so children don't, you know, fall off the system and get misdiagnosed. But we need to also be alert to children who may be neurodiverse. You know, have a look at their sleep patterns, have a look at their changes in their mood, have a look at their school performance. You know, my daughter's grades were a lot lower than my son's, and it wasn't because she didn't try as hard. It's because she just didn't understand the way that she was taught. They may need to be taught in a different manner. The education may be needed to be presented differently to them, because they're more kinesthetic learners rather than audio-visual. So we need to look at all the different learning styles when we're looking at neurodiversity. And I think we need to bring that more into the education system, because it's not one size fits all. And I know a lot of the education system in the UK, children are taught to pass exams. They're not taught about life. And that's what's missing. You know, it's life skills. It's how to cope with life as well, and social aspects of life. And we need to sort of look out, because if we don't see, they don't get the support, then that's when the self-harm comes in and the eating disorders, because that's something that the adolescents can control. So they can't control their emotions or their hormones, but they can control their feelings by self-harming and controlling what they put in their body, whether it's excessive exercise, it's eating, it's self-harm, it's drugs. So like I say, 50% of all mental health conditions will start in adolescence, and a lot of it is linked to mental health is linked to neurodiversity. Yes.
Thank you so much, Dawn, for thought-provoking presentation and for your reflections on different critical points, which are very important, often overlooked. So we request you to stay with us. We have one more presentation coming up. And now it's time to invite our third speaker, Konstantina Cheimara, advocate of mental health awareness from Greece. As the founder of the Social Issue Club at the Tata College of Greece, she has organized impactful events on issues like femicide, gender-based violence, and young empowerment. She has also attended focused seminars on trauma recovery, and her mission is to break stigma and empower individuals to seek support with courage and compassion. Konstantina, the floor is yours.
Thank you so much, Dr. Rajni, and thank you to all the team at Ecocivilisation for this invitation and for getting the ball rolling on this very important topic. I think this work is really important because even just 2 or 3 people engaging in conversation can shape our thoughts and beliefs in a different way, and maybe we can come up with an innovative tool. Who knows? We're here, we're gonna find it out. I do have a presentation to share, so I hope that the sharing issue has been fixed. So let me try to activate it. Okay. Share. I think you can see the presentation right now. Can you?
Yes, we can. Yes.
Okay. Is it all right?
Yes.
Perfect. Okay. So
Just put it in the
on the
presentation
topic.
mode, please.
I did put it in presentation mode. I can see it full screen. What about now?
It's same.
It's the same. Okay.
Yeah.
Just
Let's
keep
stop
going.
sharing and
Yeah.
share it. Okay.
You can go to the slideshow. Yeah. Yeah. Yes.
It's full screen right now? I
Yes.
can't see you because I have, okay, perfect.
Yes. Yes.
Good. All right, perfect. Okay. So our topic is how to empower ourselves to seek mental health support. This is quite a tricky topic to deal with because sometimes we don't even know that we need support. And a lot of the times we ask ourselves if something is wrong with us, if we perceive something to be wrong when in reality it is not. And a lot of the times we face the issue of toxic positivity, which is a relatively new term. When we see inspirational quotes on Instagram, the grass is always greener on the other side. And we have enough to be grateful for. So why should we complain? Why should we seek support? Our lives are just fine. We just need to take a deep breath and move on. Well, that's not the case, because even a small problem, relatively small problem, can affect you tremendously. If it costs you your mental health, your sleep, your diet, your peace of mind, well, it is a problem. Not always the solution is the same for all of us, but the very first step is to ask ourselves, how can I ask for help? You're certainly not alone, and you are allowed to speak up. You are allowed to feel your emotions, and you are allowed to seek help. This is the most crucial part. If we can accept that, then we can find our next steps. Why is it so hard, though, to accept it? I think most of the times it's because of the stigma. What is stigma? Well, so many times we limit ourselves and we limit the discussions we're having and we limit the effect that something has had on us because of our society, because of our culture, because of our families, because of our friends. It's not always easy to say, I'm not okay. If you're passing by someone on the street and you say, good morning, how are you? You don't really ask them how they are. It's a typical normative question just in our everyday lives. And most of the times we ask it without ever wanting to actively listen to the answer. So in a society where we always say, I'm fine, it's a bit difficult to admit that we're not. And even if we are fine, there are still things that we can work on to improve the quality of our lives, aren't there? Well, I would like to continue with some strategies, but my screen has frozen. Okay, why is this happening? Let's see. Okay, so why we stay silent? We already shared some of our internal thoughts that maybe some of you share. What if they don't understand? Who's they? Our friends, our family, our teacher, our employer, our neighbor. What if they don't understand what I want to communicate to them? Where do I even begin? A lot of the times I have wished that I would have this supernatural ability of communicating with my mind or reading other people's minds. This would have been so much easier because I think we have lost the beautiful art of expressing ourselves through words. Verbal communication is important and it's crucial, but it can also feel overwhelming. When you have this burden on yourself that you haven't even recognized or identified in its full capacity, how can you communicate that to someone else? And if you are able to communicate it, how can they help you? Do we know that the message has been received the way you intended to? It's a bit tricky. Also, others have it worse. There are people out there who are facing war actively right now in 2025. There are people that are living in poverty. There are people that are facing health issues. Why is it so important that I'm going through a divorce? Why is it so important that I'm having postpartum depression? I'm holding a very healthy baby in my arms. I should be stronger. So many times we use the word superhero, supermom, superwoman, super dad. So many times we applaud this being supernatural, being superhuman. But what if we're not? What if we are just humans and we're trying to navigate this journey of life as best as we can? But because of this notion that we are super beings, we don't accept help, or other people often forget to check in on us because we've got it. We're strong, we're independent, we've been through wars, so why not this time? Why is it different? Well, its scenario is different. So where do I even start? How do I untangle all of these thoughts, and how do I pass them through a channel of communication that's effective to reach the recipient? Let's talk about a few strategies here. The first step is to acknowledge without judgment what we are feeling. Let's just say to ourselves, I feel overwhelmed, I'm not fine, and I need support. This is enough. This is an adequate first step. Okay, I listen to my body. I can see that my heart pulse is increasing. I can see that my hands are shaking. I can see that I haven't slept in a while. I can see that I'm watching nightmares. I can see that I feel dizzy. I feel strong headaches. I can notice my body. My body is telling me something right now. What if my body is not telling me something? Maybe I'm not paying enough attention to it. But if that is the case, what is my mind telling me? If I were to ask the question to myself, am I fine? In secret, in private, in my own bedroom? Well, if the answer is yes, but, let's look into that but. Okay, what is there? What is underlining? Sometimes a method that can help you with that would be journaling or short reflections. We can somehow take distance from our own lives if we are using some narration tools, writing in our diaries, or even using some more tech tools. You can take your phone and vlog yourselves, vlog your everyday life. So many people have told me that they want to try journaling, but they find it boring. They are not good with words. They are not authors. they say, and it just seems time consuming, and they never get themselves to start the process. So I tell them, just use voice notes. Just open up your camera and speak to yourself as a YouTuber. What would you say? But the audience is only you. Nobody can watch it. Nobody's gonna replay it. It's just you. Sometimes people find this as an easier way to speak to themselves. Or you can even use your mirror. How many times have we tried using our hairbrush in the mirror and accepting the Oscars? Thank you so much, dear Academy. I would like to thank my mom, my dad. Okay, why not for this cause as well? Why not to have a therapy session with ourselves? So, what's the issue today, myself? Why have I been feeling that way? What can I do to make myself feel better? Just some thoughts. I'm leaving them out there for whoever wants to use it. The key point, though, is to allow yourself to feel what you're feeling and sit with it. You'll see where it goes. If we have done this process, then we can move on to step number 2. It can be overwhelming, especially if you don't know the direction that this burden you're having is taking you to. So you can confide to another individual, someone that you trust. It can be a teacher, a sibling, a colleague. It just needs to be a safe space. Someone kind, someone empathetic, an active listener, someone that's not going to judge you. If you have a person like that in your life, great. If you don't, there are resources for that. There are professionals out there, there are experts, but how can you reach them? That's a question for the next slides. But I would say that you don't have to say everything from the beginning. You can't, unfortunately, upload all of your thoughts in a USB track and hand it over to someone so that they can have a view of your whole life and understand your feelings 100%. But even if you include someone in your first chapter, your second chapter, the third chapter of your story, it's still more than nothing. You have given them some of your life's pages, and they have something to start working with. I would say that something that's crucial here is to communicate what kind of support you want to receive. Do you want to listen to ideas and brainstorm together solutions? Let's say that you're anxious about being fired in your job. Do you want solutions? Do you want them to give you some tips on how to avoid that, on how to have a conversation with your employer, or how you can uplift your CV and apply to new jobs, or if they can connect you with someone else and arrange an interview for you? Do you want them to be the task manager in this situation, or do you just want them to listen to it? Just listen, just unburden what you're feeling. Do you want them maybe to try to change your mood? Try going to the cinema, try giving you a hug, cooking you your favorite meal. What is it that you need at the specific time? And you can always change your answer. It doesn't mean that this is forever. You can say that right now, I'm not feeling comfortable receiving criticism or receiving productive ideas. I just want to unleash my thoughts. I just want to get this burden off my chest. Can you help me with that? It's okay. And then the next day, with some clear mind, you can go back to planning mode. So I would say finding a safe person is important, but also communicating the kind of support you want to receive is essential. Some support options that we have. Of course, therapy, school counselors, lots of support groups or helplines. But I would also agree with Dawn that it's not a one-size-fits-all situation. Therapy is not for everyone, okay? Life coaches are not for everyone. Yoga and meditation are not for everyone. So a conversation with a counselor in your job could be enough. Watching videos on YouTube, for you, it could be enough. I would suggest, though, that if it's something that's affecting your health, your physical health, and others around you have observed that it can cause damage, it would be ideal to try different styles of therapy. So many people have this aversion against therapy, but in reality, it's not therapy by itself. It's the style that they had followed, or perhaps the professional that they had connected with, or even the time being of their lives. You don't have the same needs and wishes when you're 20, when you're 30, and when you're 40. So we need to adapt and perhaps switch the ankle a little bit. The most important part, though, is our surroundings, and the support system that we have 24/7 in our lives usually is our friends and our family. You can have a professional, an expert, a counselor, but this is usually with appointments, and it's not on a daily basis. So who we surround ourselves with is very important. You've already heard of it, I'm pretty sure about it. But how can we become this community that fosters care, love, understanding, empathy? First of all, we can listen without fixing, because I mentioned previously that it's quite crucial to communicate your need at the time being. I need just to vent. But what if you don't know what you need at the moment? Well, if you don't know what you need and you don't communicate that, then the recipient, the friend or the family member, should first try listening, not try fixing. I think this is a common denominator in lots of cultures where we can see close family bonds. And so many people say, I want to share this experience with my family. I want to share my troubles. I want to share my anxiety. I want to share my thoughts, but they take over me. They take control. They nag me. They try to direct me to a specific path. It can happen. I would like to stay optimistic and say that this is a response out of love. And usually, if you do have a strong family bond with a member, they want what's best for you. Unfortunately, not everyone follows this first step, listen without fixing. They are eager to help you. They don't want you to see, they don't want to see you in pain. So naturally, they are trying to take away the stressor. That's not always the case, though. So what could we say if we care about someone? How can I support you? How can I be there for you? Do you want a shoulder to cry on? Do you just want to go out for ice cream? Let's take the lead. The other person is in a vulnerable state, and they have taken the first step to acknowledge their vulnerability. They are courageous right now because they are sharing with us this part of their complex thoughts and their complex feelings. So let's embrace that. Let's protect it, and let's treat it with love and patience. Finding resources is also a very crucial part. I do have some slides after this one, but how can you find resources if you have depression and merely the thought of getting out of bed keeps you up at night and it exhausts your body? It's pretty simple to say, just Google it. But this seems like a negligent statement to make. We need our friends and family to be there for us, to listen to us, and help us, almost taking us by our hands, if that's the case. If we have this enormous mountain in front of us and we cannot climb it on our own, we need someone to give us a vest, give us a helmet, and take our hand and lead us in the beginning. This is not control. It's not the same as the previous cases I described. This is love, and this is thoughtfulness. So we need to remind ourselves that we are a community, we are a team, and no one is a burden. What happens though if there's no support there? What happens if we don't have this inner circle? What happens if we have communicated our needs and the style of communication and support we want to receive, but it's a dead end? It can happen multiple times in numerous occasions. Individuals cannot receive support from their environment. Well, first of all, you need to remember that this is not your fault. This is not something that you have caused. It's just that the other person doesn't have the capacity or the emotional intelligence for that. It's a shame. You can feel sad about it. It is not fair. You are allowed to feel this feeling as well. And it's okay to seek support elsewhere, in a different environment, in a different community, in a professional capacity. Your voice still matters, and your problem is still important, even if it's not acknowledged by your immediate circle. So take a breath, count to 4, and then ask yourselves, what would it look like to choose courage over silence? Just once this week. Even once. Today, tomorrow, on Sunday, on a day that you can feel slightly more uplifted. Even one step is enough to start healing. It truly is. I have listed here some resources for some general mental health support. This is an example of changing environments that we mentioned before. If we cannot find support within our circle, within our job, within our school, within our university, we live in a time that thankfully it is accessible to locate some institutions, some web pages, some information. Not for all.
Looks like Konstantina is facing some network issues.
Someone needs them. These are also some youth and identity specific support hotlines. But I would like to give you the tool or a general idea on how you can search these resources on your own, in case there is literally nobody out there that can help you with that. So I'm assuming that you have some Wi-Fi connection or a device since you're joining this webinar. So what is the first step? Let's start local. So we need to search national helplines and mental health organizations in your specific country. I'm from Greece, so let's say I need a hotline for depression. I will open my app, my Google, and search hotlines for depression, Greece. It's ideal to also search it in the language of the country you're targeting, because usually most of these organizations don't receive enough funding to tailor to their web pages, and they might not offer this information in English. So start local. Then check if there are some resources available in your community, in your immediate environment. Is there some free counseling offered in your university, in your school, by your employer, in your company? Does your insurance cover it? It is overwhelming, I know, but for lack of having someone to do it for you, or for lack of support, this is a checklist. So start local and then check if there are available resources around you. Talk to a trusted person, as we said, that might look out for you, that might know something better than you, or they might have the energy to search online and guide you. You can use some reliable websites like Mind or Mental Health Europe in the specific case of Europe, or Befrienders to explore options. These are verified sites that are pretty resourceful. And of course, there are plenty of apps on Google Store or App Store, like BetterHelp, 7Caps, or Calm that you can use for support. Again, I know that this can sound overwhelming to someone that has never faced something like that before, or that struggles to get up out of bed every morning. So this could be your screenshot, like a checklist to do a step-by-step, or you can try using some of the resources in the previous slides. I would like to leave you with this closing message, that you are allowed to ask for help, you are allowed to speak, and you are worth being heard. And with that, I mean, you're worthy of support, not only when your whole world falls apart, but every day. So my wish to all of you attending this beautiful webinar is to find this support group, to find this community, and receive and give support on a daily basis, not just when we are at our lowest point. We need support daily to celebrate our victories, to celebrate our accomplishments, and to just be there for each other. That's it for me. You can always feel free to connect with me. And now the floor is open to some interesting conversation. Thank you.
Thank you. Thank you so much, Konstantina, for sharing with us such a practical guidance, pragmatic tips. I'm sure it's going to help many people, especially the information that you have shared by sharing the screenshots and all that, because it's a very practical guidance. Thank you for that. And as we learn that you have been extensively working on various women-related issues like femicide, gender violence. So I want to understand, how are you working with these women to come out, with the kind of impact of the trauma they have had on their mental health in a very short?
Yeah. So gender-based violence is a tricky concept, as we can find very severe trauma in most cases. So this can lead from, it can expand from anxiety to depression to PTSD and emotional numbness. So the person that's trying to seek help is not able to receive it because they're in a state of shock most of the times. Again, I would say that silence and stigma surrounding these issues can worsen the mental health impact and delay healing. So breaking the silence is the first empowering step. It helps survivors reclaim their voice and actually begin their healing process. You don't have to share your whole story with the world. You don't have to be an influencer. Just break the silence and just acknowledge what happened, confide in a trusted person, reach out for help. And I guess, well, as therapists, we got you. We're here for you. I hope that one day our society has evolved so much that we can say the same sentence for each and every single one member of our community. We got you. We're here for you.
Thank you. Thank you so much. Violeta has something to say.
I would just like to ask, thank you all three of you for a really beautiful angles and very personal sharing of your experiences. But I wonder if you know those that have entered this so-called tunnel of either depression or any other mental challenge, do they have enough strength to reach out? Do they, at what point do you get aware of your troubles, or how long does it take to actually understand and get the courage to reach out? What I'm saying is, can we just download that to an individual, or can we actually do more as a society? What are your experiences telling you?
Is this question targeted to me or to all of us?
All three of you.
Okay, since I have my mic on, I will answer it so that I can give the floor to the rest of the panelists later. It's not the same case with everyone, obviously. I would say it's really helpful when you do have a supportive community around you because they notice changes in your behavior. So trust them. And when you do have these people in your life, you trust that when they are worried about you, they have a reason to worry about you. So this certainly helps start the process. If that's not the case, I would say that it's pretty dangerous and you can get stuck in a loop where reality has shifted and the new normality is to feel burdened. And it is very difficult to break this cycle. Usually it takes a very low point to do so. A day without having eaten at all, multiple times fainting, developing an autoimmune disorder. You need a shock. You need something that will tell to your brain, okay, we need to stop this. It has become a pattern. It has become your reality now. So you can't actually distinguish and differentiate this in your own thoughts. So I would say, yes, community would make an impact and it would change everything because they are the ones that spend their lives with you. You share your lives with them. So they notice these changes, they are there to help you, and they are trying to pull you out of this dark hole. If that's not the case, it can take a long time to realize it. And unfortunately, it can cause some serious physical damage as well. At least that's my point. I would give the floor now to the rest of the panelists. Thank you, Violeta, for the interesting question.
Please unmute yourself, Dawn.
That does help. That's twice now. I'll just add to what Konstantina said. I mean, it takes a village to raise a child. You know, we all need to put our arms around people, and people don't reach out because of fear. Fear of judgment, fear of failure, fear of the unknown, fear of success, limiting beliefs, and losing control and not being in control. So I think, that's what's stopping people. That's what's holding people back. And again, going back to what we said earlier about stigma, stigma and shame is holding people back and preventing people from asking for help. So, yeah, that's just my sort of take on it, really. I'll hand back over to the panel.
Ruksheda?
Thank you so much. I think I'm going to also respond to, I think, some of the chat that I saw earlier. So I have learning disability, dysgraphia, dyscalculia, dyspraxia, all of it. And I also have ADD, so I am kind of neurodivergent in that way as well. And of course, wasn't diagnosed in childhood. In fact, didn't diagnose till way into my own career as a psychiatrist. Having said that, some of the comments was like, yes, in India, there is still a lack of awareness amongst parents, educators, and then definitely because of that is in children as well. Having said that, and also the healthcare is not uniform. But I do come from Mumbai, which is a huge city with a huge amount of population, and I also happen to be the president of Bombay Psychiatric Society. Our city is doing phenomenally well in this particular field. So we definitely know that mental health literacy and awareness in educators is such an important aspect of screening children and helping them. Also, unlike developing countries, our developed countries, our country is much faster in terms of providing that kind of diagnosis to children, because I hear from my colleagues from across the oceans, from Europe and the US, the waiting period for diagnosis of a child is 2 years to even 7 years in some cases, which then means that there is no early intervention. We can sit here and talk about early diagnosis, early intervention for better outcomes, all we like, but unless and until we also change those systemic issues where there's such a backlog of help. So on one case, there might be a lot of awareness, but not enough help. On the other case, there is a lot of, there's lack of awareness, but thankfully help is a little bit more easier and available. So we do need to kind of look at it from a global perspective as well. Having said that, apart from all of the stigma and the shame, we talk about that doesn't allow people to seek help in a timely fashion, or to continue to seek help, because there's one, okay, I'm approaching somebody for help, and there's another that I'm continuing to take help. So those are two different kind of hills that we have to conquer. I'm so proud of the younger people. I'm so proud of the younger generation, the emerging adults, the young adults, because they're really the flag bearer of mental health, whether that's verbalizing it, amplifying the volume on mental health and conversations around psychiatric care, and they are our hope at the end of the day. I've been working with teenagers and adolescents and young adults since almost 22 years now, and even 22 years ago, my young clients would be the ones who would tell their parents, I need to go see someone, you need to find someone for me. So even at so long ago, like more than 2 decades ago, that has been my experience. So I think we do definitely want to look at the entire scenario with a little bit more optimism, because that's also going to help us find more solutions. And we keep underlying the issues, but we also need to focus on what's working, so that more and more policymakers and change makers sit up and take notice. And hopefully, those bridges and those gaps are something that we can cross all together. So thank you so much.
Thank you. Thank you so much, Dr. Ruksheda, for taking in your answer the concern which was being shared, which was being discussed in the comment box also. In fact, I was about to ask you to address that, being somebody from India, being a doctor psychiatrist from India. So thank you so much for taking that aspect also, including that aspect also into your answer. And now I request all participants to feel free to ask any related question if they have. If they have, please write your question in the comment box, or you can directly ask to. Eleftheria, do you have any question?
Yes, I would love to ask the whole panel just their experience or insights in and around seeing that anxiety seems to have risen a lot around, especially our youth. And how could we support that? I can see that just a lot of youth anxiety seems to be through the roof. And so how can we, as a community, as a circle, as family, how can we support our youth with that?
I don't mind going first on this one. I think we alluded to social media in the conversations earlier, and social media has contributed hugely to anxiety in the youth. I mean, if you take back many years ago when I was a child, in my youth, when I used to go to school, if there was name calling, if there was bullying, if there was any type of aggression or conflict in school, you would leave at 4 p.m. and you would go home into a safe environment. And I think anxiety is through the roof because there is no downtime for our youth. You know, social media, they're getting attacked online. They've got the name calling, the bullying, 24 hours a day, 7 days a week. And I'm just going back to when my daughter had a prom. I know one of her friends bought the same prom dress as one of the other girls, and she was getting death threats on social media. If you wear this dress to prom, you will die. And it's just things like this, which is, you know, blowing the whole youth anxiety through the roof. And this is what they're dealing with 24/7. They're dealing with name calling and they have access to each other 24 hours a day. There's no downtime. So I think what we can do to help is having regular check-ins with our children when they're online. Make sure that we're checking in with them when they're online, knowing who they're talking to, regular conversations, making sure that they are okay, putting boundaries in place with telephones, with social media, because it is contributing to huge anxiety. You know, like I said, I can see the difference from when I was a teenager to when my children were teenagers, and a lot more support in schools as well. And I think schools need to have some form of commitment and responsibility to educating and checking in with children, because anxiety in examinations as well, and the way that they're educated is contributing factors. So I think regular conversations, put more boundaries in place, check in with them. I mean, we're all very busy, life is fast. And again, going back to when I was raised, my mother stayed home to look after the children and my father went out to work. Now both mum and dad have to work. So again, that's different. So children are having less time with families, and they're having to you know, find their own way in life more, rather than being in that nurtured environment, which again, I think is contributing to anxiety. So be present with the youth, spend more time, because they don't want our money, they want our time, they want our love. And I think we just need to appreciate that. And we're all working, but how much is enough? You know, you can earn more money, but you can't get more time. And I think that's my message that I'd like to get across.
Thank you.
Could I also share
So-
some thoughts? Okay, so I would say that social media and peer pressure are obviously one of the main reasons for the fact that anxiety has been skyrocketed among youth. I would also say that we live in a time in history where we also have, apart from economic uncertainty, environmental uncertainty. We have woken up and we realize that this is our only planet. Well, pardon me, we have screwed up. What to do now? I also believe that going through a pandemic, isolation and lack of connection were not temporary. They stuck. They became permanent, part of our routine and part of our way of communicating. And I can see it in myself as well. I would like to consider myself as youth. I don't know. At the age of 25, I no longer want to receive phone calls that much. If a friend of mine calls me instead of texting me first, I assume that something is wrong. It wasn't the case before COVID. But with COVID and with the quarantine and everything, days and nights sort of blurred. So communication could not happen via phone because you didn't know if the other person is sleeping or eating or doing something else to cope. And this preferred method of using texts has stayed. At least that's what I've been observing. And I would also like to point out the overexposure to bad news. So many people keep telling me, oh my God, you're so much socially aware, you know, these minority groups issues, you know how to deal with that person, you know about this disaster there. It's not because I'm socially aware always by choice. It's because I've been bombarded with all of this information. And while we do want to be informed, and we should be informed as we share a planet and we're all human beings, we should have our moments. Back in the day, there used to be the newscast, 1 hour, that's your news. Of course, it could be controlled, okay? And it could be censored. Right now, we do have access to information, but it's not like we voluntarily choose it. If you open TikTok, the algorithm is going to pick up, based on your interests, news out there. And if you are a socially aware person and you do want to find out what's happening in the world, you're going to see so many videos of so many injustices around the world. And at least for me, this is challenging, trying to not lose hope in humanity. When you see about this femicide, that rape case, that war happening over there, this conflict, this poverty rising over there, and I see it every day. And then I see a cute baby eating and I forget it. But I would say overexposure to bad news and the lack of communication as it used to happen in the pre-COVID era are some important factors. So what I would suggest is our families and friends, power, but not pressure. When I bring to the table the fact that I feel like I've lost hope in humanity, don't diminish my feelings because, well, there's always good people. There's always good people. But in my phone, I keep seeing injustices. This wasn't an issue before, not to this extent. So I would appreciate others trying to educate themselves on current issues and on current mental health issues. Phantom vibration syndrome wasn't an issue before. Cyber addiction before. It is now. So I would appreciate my mother spending time understanding that. I would appreciate my professors, my colleagues who are older than me to spend some time and get informed about these topics. Just my thoughts.
Okay, thank you so much. And anybody wants to say anything because before closing, so we request that anybody, if they want to say any final words, they are most welcome, else we are moving towards the closing. Okay, so shall we? Okay, so that was definitely truly insightful and impactful session, and I hope this session is going to help many people. And once again, a huge thanks to our esteemed speakers, Dr. Ruksheda, Syeda, Dawn, Evans, and Konstantina, for sharing your valuable expertise, knowledge with us today. And we also extend our gratitude and thanks to our participants for their active participation and thought-provoking concerns. That's very important for a discussion. And for upcoming events, keep visiting www.ecocivilisation.eu. And thank you once again for joining us. We look forward to seeing you next time. And take care and goodbye.
Thank you so much. Bye.
Thank you. Bye now.
Thank you. Thank you so much. Thank you. We appreciate it. Thank you, Konstantina. Thank you.